The class of 2018, a recent graduate of Macalester College as a biology major and chemistry major. He was a finalist in our Shea Scout athlete program. He played Division III football at Macalester College, a national finalist for the Debate for Democracy Memorandum writing competition. He is going to be an incoming medical student at the University of Minnesota Medical School. He has been volunteering with the Guam Medical Association since he was 11. He is committed to becoming one of Guam's more elite physicians to help improve Guam's healthcare infrastructure. And he told me himself that when he's done, he'll be taking over my clinic and my practice. That's a joke, but I'm hoping so anyway. Because of how long it is to take from medical school to residency for him to become a physician, that it's going to take him probably nine years from today. 9 years from today to 10 years. Before he comes back and be able to practice independently. That is how long it takes to create a doctor from college to medical school to residency, about 8 to 9 years, depending on what specialty the residency goes into. If you add on the 4 years of college, it takes about a good 14 years to create a physician to be able to practice. So, without further ado, I want to welcome and give a big hand of applause to Mr. Kai Akimoto. So I'm going to have Kai kind of go over the rules first. I know that both the candidates are here. I'll introduce the candidate, both teams. But let's have Kai kind of go over the rules before we introduce the candidate.
Thank you very much, Dr. Shea. As far as the outline of the program of the debate, there will be 3 30-minute segments with a 5-minute intermission in between each segment. Segment 1 will be between the 2 candidates for governor. Segment 2 will be for the lieutenant governor candidates. And then the final segment will be for both the governor and lieutenant governor. We will begin each segment with a coin toss to decide which of the candidates will receive the first question. And then the first question will be asked immediately after the coin toss. The candidate in question, who receives the question, will have 2 minutes to answer the question. Then the opposing candidate will have a 1-minute rebuttal period. And then the candidate in question will again have 30 seconds to respond to the rebuttal. And then we will move on to the next question. After the final segment where both candidates, or both Lieutenant Governor and Governor are on stage, each candidate will be given 2 minutes for closing remarks, beginning with the winner of the coin toss. At the moderator's discretion, the discussion of the question may be extended by 30 seconds per candidate. We do have a timer, who will be introduced by Dr. Shea, who will display a 30-second warning, a 20-second warning, and a stop sign. And when the stop sign is displayed, the candidate must conclude their statement and will not be allowed to include an additional statement. So those are all the rules for tonight's debate. Thank you very much.
Thank you, Kai. I told you he was articulate, right? Before I go on, I want to introduce Dr. Bo from GRMC and Amanda Rosario from AMC. Both of them are Sergeant of Arms here. They will be able to escort people out, and they will help clarify any question that may have in the debate regarding medical terminology, but I don't think that's going to be necessary. We got Kai behind here. Without further ado, I want to go ahead and introduce both candidates, and we know them very well. I want to welcome to the stage the team of the current governor and lieutenant governor, Lou and Josh. Your choice. And let's welcome our other candidate team, the team of Michael and Sabrina, Congressman Michael and Nicolas and Sabrina Matanane. Okay, let's go ahead and have a seat. Can we have the next fun part. This is the fun part. It's a coin toss. Because we don't know, I forgot to introduce the timekeeper. Timekeeper, Dr. Billy and Erica Alfred. There we go. Now, we're not going to be like super strict, like, okay, 30 seconds, quiet, done, boom. We let you finish your sentence, okay? Just to be a courteous we can to the candidates. Coin toss. Governor and Hi. You want to do the honors? Yes. Kai's a football player, so he especially requested. Governor, would you call heads or tails? Okay, so, Kai, head up. It is tails, so you can either receive or you can punt. It's football center. So you can punt or you receive first. Okay. Okay. Make sure you silence your phones and let's have a great debate. Oh, and candidate, you can take out your mask. You're okay.
Thank you very much. So the first segment will feature two gubernatorial candidates. So the Governor of Guerrero and Congressman Nicolas, would you please make your way to the podiums? So for the first question for Governor Leon Guerrero is in regards to the hospital. So as we all agree, Guam Memorial Hospital is structurally unsound, illustrated by the recent demolition of the Z-Wing. A new public hospital would be a very timely addition to the healthcare system of our island. What factors are most important for consideration in identifying the location of a new hospital? Your 2 minutes will begin now.
Thank you very much. Of course, a new hospital is very much needed. The Army Corps of Engineers has said to us the life of our current hospital is only 5 years. So it's very urgent that we then build a new hospital. The factors that have gone into the location is first, space, acreage, and in a central location. We now have a hospital in the west side of the island. We would like to have a hospital in the east side of the island, and that is more accessible to the south, the central, and of course, there is already a hospital in the northern side. Additional to that is a space that would then be able to house not just the new hospital, but also public health, behavioral health, a veterans clinic, and of course, public health, and a new public health laboratory. Also factored in there is the topography. Factored there is the infrastructure accessibility. Factored in there is the traffic. So these are all the elements that have gone into assessing and deciding and locating where a new hospital should be built.
Thank you very much, Governor. Congressman Nicolas, your 1 minute rebuttal will begin now.
Could you repeat the question real quick?
Yes. So, as we all agree, GMH is structurally unsound, illustrated by the recent demolition of the Z-Wing. A new public hospital would be a timely addition to our island's healthcare system. What factors are most important for consideration in identifying the location of a new hospital?
If we were constructing a new hospital without an existing facility, without an existing system of care, then we could be a lot more flexible in where we want to place it and factor in other considerations like geography or proximity to certain demographics in our community. But at this juncture, we really need to place a hospital in consideration of the fact that it has to be a functional facility. And when I say functional, that means that it actually needs to work with our existing system of healthcare. In communication with our doctors, it's become clear that there are many concerns about placing the hospital in the current proposed location down in Eagle Field because of the proximity issues in the existing system of care. The doctors want to be able to get to a hospital faster because their existing operations, for the most part, are more along the Tamuning central part of the island North Central. And so we already have an existing plot of land that's been identified. There's a generous family that donated it to us years ago at Oka Point. And so if we can stay focused on the fact that we have a functional facility that works for our existing system of care, I think the best place for our hospital is up in Oka Point.
Governor Leon Guerrero, you have 30 seconds for your response.
Actually, my main priority in the location of this hospital is of our patients. And the priority is our citizens and the accessibility for our citizens. That's the priority. There is a system of healthcare delivery in the central of our island. There is certainly Dr. Wynn's clinic, which is only 2 minutes away from the new hospital. So my priority primarily is providing more the convenience, the access of our people of Guam.
Thank you very much, Governor. So we'll move on to the next question. This next question is also in regards to the hospital, and it will be for Congressman Nicolas. While a new hospital has been estimated to take 4 to 7 years to be constructed, Guam Memorial Hospital remains the only public hospital, as well as the only inpatient care facility with an active labor and delivery ward. What improvements would you make to GMH in the meantime for Guam women and children?
I just want to do a quick shout out to my kids. This is their first time seeing Daddy live. My family came in, so I just wanted to say hi to you guys so much. GMH is going to have a useful life for another 7 years, maximum, maybe a little bit more if the new hospital is going to take longer than we anticipated. And so we need to make sure that we continue to invest in the existing GMH so it's going to be able to provide the same standard of care that our people are going to be needing over that 7-year period. From an investment standpoint, it will be wise for us to make sure we marry any assets that we're going to continue to pump into the GMH facility with the useful life of that particular investment, and then the return on investment, not just in terms of patient quality of care, but in terms of whether or not it's going to help us generate revenue, because the hospitals always had a revenue problem. Dr. Shea has been an advocate for many years about renovating the labor and delivery ward. That's a common sense investment. It is a profit center for the hospital. And then if we make those investments early on with the resources we already have, we can extend the benefit of a renovated labor and delivery ward and get the maximum value out of that 7-year investment. We're going to need GMH for 7 more years. So let's make sure we pump resources in where it's going to make sense. Definitely renovating labor and delivery is one of them. And then we should also have conversations about the future of GMH. Are we really going to just move out from that facility and then it turns into just another skeletal Guam building? Or are we going to find new ways to repurpose it for adding additional services for healthcare? If we're going to invest, for example, in a labor and delivery ward, perhaps we should consider also converting it into a children's hospital or a senior citizens hospital, or a combination of both that are young or older interacting. There's so many different possibilities that we can make, that we can explore with GMH. But the reality that we have a 7-year timeline that needs to be dealt with is something that we're going to have to face, and we have to make the right investments to maximize that useful life.
Thank you very much, Congressman. Governor, you have your 1-minute response or rebuttal.
Yes, the reality is it is only 5 years of life. And we are pumping in money to make GMH more safe, to make GMH more operable. We are putting money into helping fix the roof and a wraparound to make sure that leaks don't happen when it is raining. We are putting money in to make sure that the electricity is safe and it's relocated to a safer place. Labor and delivery, yes, is a generating revenue service. And expanding or renovating or improving it certainly could be done. But we need to make sure that whatever investment we do, we don't make it so that we are not being able, so we won't be able to shift those resources more to building a new hospital.
Thank you very much, Governor. Congressman, you have your 30-second response.
I would always like to be optimistic when it comes to timelines, but one of the things that I've come to realize in my service in government is that when it comes to Guam projects, the most optimistic timelines are certainly the least likely to turn out. And so pursuing a new hospital, and I'm hoping we get more of that conversation in the future, it definitely is something that needs to be done, but the timeline on that is something that we need to be realistic with. The realism in terms of how quickly we're going to be able to get it built, and how long we're going to have to depend on GMH. And if it's going to be 5 years, I hope so, but I really think 7 years, 10 years is a lot better to plan around for realistic purposes.
Thank you very much, Congressman. The next question will be in regards to, again, the hospital, and particularly the hospital funding. And this one will be for Governor Leon Guerrero. So Governor Leon Guerrero, GMH, like other healthcare agencies on Guam, has been fortunate to benefit from the emergency federal funding that was made available to combat the pandemic. But as the world moves on from COVID, these emergency funds will be taken away. Do you believe that it is time to create a dedicated funding source for GMH? Why and how?
Certainly this pandemic has pumped in a lot of money into our healthcare. And GMH has been a recipient of a lot of those. GMH does have a dedicated source of funding, and that is the pharmaceutical fund. Additionally, our administration has pumped over $30 million out to GMH for nurses, for traveling nurses, to provide the services and the care to our people, especially during this pandemic. The government is not going to abandon GMH. The government is going to support GMH. And if we have to increase the funding source to GMH so that it can operate, we will. That is our commitment, and that is our pledge and promise to our people of Guam. Additionally, if we expanded our Medicaid, which we have, and shifted uninsured patients into Medicaid, it would decrease the burden of expenses to GMH when these underserved and underinsured people come to GMH for their care, which is the most expensive way of accessing care through the emergency room. So if we can work to shift those people into Medicaid, decrease the financial burden of GMH, and also they are contracted with a organization that helps them improve their processes of collection. And just over the last 3 months, they have improved their collections. So if we improve collections, we decrease financial burden, maybe the need for those kinds of revenues would not be there.
Thank you very much, Governor. Congressman, you have your 1 minute rebuttal.
The dedicated funding source for healthcare is a really sad story in the history of our government. One of the main revenue streams for that is the collection of tobacco taxes. And that has been just so woefully it has not been done. And I've been fighting for that for years, fought for it as a senator, introduced things as a congressman, but really administratively we need to be collecting all those tobacco taxes. Because not only is it supposed to serve as a disincentive for a very deadly habit, but it's also supposed to provide that funding for healthcare. And as long as we don't collect on those taxes, we're not going to have the revenue we need. Additionally, we did correct the Medicaid imbalances in terms of the federal government's matching, and I think that resulted in about a $21 million improvement in the general fund. Unfortunately, we didn't take that $21 million and reinvest it into healthcare. We're taking that $21 million and putting it elsewhere. We need to keep healthcare dollars in the healthcare system. When we improve our Medicaid collection rates, our Medicaid reimbursement rates, those dollars should be going back into the hospital and healthcare system.
Thank you, Congressman. Governor, you have your 30-second response.
You know, the congressman is totally wrong. The congressman's research is weak. The source of this funding is not from tobacco. The source of this funding is from gross receipt taxes. 6% of that goes to GMH. So if he would do his research a lot more accurately, he would not be misleading our people. So the funding source is not weak. The funding source is very strong. Our VPT is strong. Our economy is strong. Our finances are stable.
Thank you, Governor. The next question will be in regards to healthcare access, and this is going to be for Congressman Nicolas. So, Congressman, with the economic hardships of COVID-19 pandemic causing many to turn to public programs for healthcare coverage, public health has become more overwhelmed with this increase of Medicaid and MIP patients, making it too difficult for many to feasibly get the care that they need. What is your plan to improve access to care? And your 2 minutes will begin now.
Could you repeat the question, Pat?
Yes.
I'm happy to.
So, as more citizens become reliant on public programs for their health care, public health and other facilities that would accept this coverage become overwhelmed as this volume increases. Does your administration have any plans for alleviating some of the burden that is now falling on these public services in terms of healthcare?
So just to clarify, your question is because we have more Medicaid funding, it's creating more demand in the system, and how are we going to alleviate that demand?
Yes, Your Honor.
Well, I mean, I guess that's a double-edged sword, right? When you have more resources, you're able to provide more healthcare. Bottom line is that when you have Medicaid dollars coming into the system, and those Medicaid dollars are supposed to be going to be paying for treatments, the dollars should be matching up to the cost to provide the service. If they're not, that's a conversation we all need to sit down and have. Because then we need to work together to update the Medicaid state plan, which is, by the way, something we really need to do. I remember pulling up the Medicaid state plan on Guam, and I think it's still on the typewriter format. It's been that long since we've updated it. And updating the Medicaid state plan will go a long way towards making sure the dollars for the treatments are matching up the cost of the services provided. On top of that, the quality of care will be updated by updating the Medicaid state plan. When speaking with some of our doctors, there was concern about, for example, Medicaid covering insulin. Because right now, insulin covered under Medicaid, you have to get the little bottle and get the little syringe, and that's the only type of insulin that will be covered by Medicaid. If we update our Medicaid state plan, we can cover insulin the same way they do it in California with Medicaid. It's the pen injection thingy that's going to be a lot more efficient for the patients. It doesn't have temperature control requirements that make the efficacy of the vial medicine a lot more questionable. So there's so many ways that we can improve the cost challenges in terms of delivering on the service, the quality of service, and the quality of the healthcare that we're able to provide. We just got to make sure the Medicaid dollars are adequate to fund for the services being rendered. I mean, I'm actually disturbed to hear that there may be an imbalance there, because the whole purpose of us having Medicaid for our Indian community is to have those federal dollars and those local dollars being able to pay for the cost of care. Because otherwise, we're going to continue to subsidize that with tax dollars, or clinics are going to keep eating it on the back end on their losses.
Thank you, Congressman. Governor, you will have your 1 minute, and if you need to repeat the question, I can.
No. Access to Medicaid is very convenient. We just increased Medicaid from $18 million to $133 million. We just expanded Medicaid enrollment and eligibility. And yes, we did it by revising our state plan. We revised our state plan, sent it off to HHS, and they approved it. So I don't know what typewriter the Congressman is talking about, because it's digitalized and up in the website. We just currently also expanded and provided COFA citizens Medicaid. So this increase in volume of enrollment to Medicaid is really a good thing, because that means more people are getting insured. That means more people have access to health care. And that's what we are all about, providing that access.
Thank you very much, Governor. Congressman, you'll have your 30-second response.
I think the question was focused on making sure that providing Medicaid was going to still be affordable, or something that was going to be sensible from a cost basis for the amount of money that Medicaid is funding. But yes, I mean, we did a lot of congressional work to make sure we got those matching rates increased, and we did a lot of congressional work to make sure COPA Medicaid became a reality. Since 1995, we haven't had that. So it's a really good thing that there's a lot more Medicaid access, but I think the question is, are we really making sure that the dollars coming into Medicaid are adequate to provide the services? And that's something we really need to make sure we're doing properly.
Thank you, Congressman. The next question is in regards to the nursing shortage. And this one will be for Governor Guerrero.
Yes.
So, Governor, with the chronic shortage of nursing staff on the island, what is your administration's plan to alleviate this shortage?
We have plans to alleviate shortage, not just plans, but we've acted on them. We've increased nursing salaries, pay increase, because we saw that nurses were leaving for better compensation. We also work very closely with the University of Guam. We've given them resources and financial aid to expand their nursing capabilities, their nursing school capabilities. We work very closely with GCC, because GCC also provides nursing students and nursing workers for our hospital. And we also have been working with legislation where we passed a legislation that allowed for a network of reciprocity among the Western Coast individuals, so that nurses then now can move from one state to the other freely without having to go through licensing processes. Nurses are very important to our island. Nurses, as you know, as doctors, are the backbone of the care of the hospital. So we have to do everything we possibly can, and we are, to provide them the gap and to close the gap of those shortages.
Thank you, Governor. Congressman Nicolas, you have your 1 minute rebuttal.
Thank you. The nursing shortage issue has been with us perennially, and it's not getting any better. We are kind of kiting the situation with traveling nurses, but once that dries up, we're going to be right back to square one. The interesting thing, as we went through the years of all of these healthcare issues, whenever you see the news saying there's a shortage of beds, it doesn't necessarily mean there's a lack of an actual physical bed. Our healthcare professionals educated me on this. It means that there may be a bed, but there's still a lack of a professional able to service that bed. And so technically that bed is taken out of commission. So when we see all these stories in the past of a lack of beds, it's because we either had facility issues or staffing issues. And to address those issues, we absolutely need to be making the investments into building up the available nursing workforce. The medical professionals I've spoken with have been sharing with me that the investments that have been made thus far are not adequate. And this administration has had emergency powers to be able to do those things. They've had enormous amounts of funding to be able to do those things. And for us to be having a conversation now where that isn't resolved is very, very disheartening.
Thank you, Congressman.
Yes, I've been in nursing now for more than 30 years. And more than 30 years. I won't say because then you'll know how old I am. But I've been in nursing, and this isn't an issue that we are just addressing today. I have worked with the nursing profession to provide certification from the University of Guam to certify that their curriculum is up to par. So to say that this is just, we're doing it now, is furthest from the truth.
Congressman Nicolas, you can have your 30-second response. Oh, apologies. Sorry, Governor. Oh, next question. It's a very elaborate response there. So the next question will be in regards to the physician shortage. Guam's healthcare system is in crisis. While we have always been lacking needed specialists, we are also expecting several primary care physicians to retire in the next 5 to 10 years. What is your administration's plan to recruit physicians?
Really need this specialty here. We bring in one specialist to be able to fill that void. What happens is the need is so great that the work becomes so demanding that one specialist gets overwhelmed, and all of a sudden, they fulfill their contract and they get out of here because it's just overwhelming them. Same thing's happening to our physicians. Those of you who have been serving our community for a very, very long time. A lot of you think about the future. You think about spending more time with your families, going into retirement. But because you're just such dedicated public servants, you're all putting that off because you know that if you go away, that same problem that we have with specialists is going to spill right into your particular fields. So we need to do more when it comes to recruiting, and we need to be smart about it. We can't just say we're going to go out there and recruit one specialist. We need to work with our clinics and find ways where we can help incentivize them to be able to go out and find these specialists and have us offset the cost of doing so. One of the examples that we can follow for that is helping them by subsidizing H1 recruitment. That's something that we need to be pursuing. Subsidize the H1 recruitment, push manpower development funds into that subsidy so that we reduce the risk of them having to go out there and front that licensure cost and bring in these specialists, but not just one. Let's bring in a handful so the workload gets spread out so they don't all of a sudden bail because the job is just too much for them to bear. If we plan things out properly, we acknowledge the problem, we work with our private sector and our clinics, and we subsidize where subsidies are needed, we can resolve this. But it's going to take us having a holistic approach, being very realistic with the problem, and having very realistic solutions to address it.
Thank you, Congressman. Governor, you may have your 1 minute rebuttal.
Thank you. Yes, physician shortage is a concern. I understand we have 452 physicians here, but we need more. And we have to really identify which specialties that are short. And if we do identify those, we can work with other hospitals to partner and have an agreement to send over their specialists on a rotating basis. We do that now with cardiology. We can do that with gastroenterology. We can do that with endocrinology. We can do that with dermatology. That's the kind of actions and plans. We also are working with recruiters, and I know that Lillian is recruiting aggressively through their global network of physicians. We also have to make sure that the processing of licensing is efficient and effective and quick, so we don't lose those opportunities of potential physicians coming to Guam.
Thank you very much, Governor. Congressman, you have your 30-second response.
Yeah, I agree with the sentiments of the governor as well. I think it's important for everybody to be on board with this issue because this is certainly not a political issue. This is a healthcare issue. And one of the things we also need to look at are the existing resources we're deploying. I know that the Protect Scholarship, I believe, that allows you to go out and get your medical degree, it doesn't actually allow you to further tap into that resource to go into specialization. When we have these resources that are out there, we shouldn't be having these roadblocks that are holding us back from actually getting to the solution that we're looking for. So we need to work together to solve those things.
Thank you, Congressman. The next question is in regards to healthcare provider shortage in general. So, Governor, may you elaborate on the short-term and long-term goals to support and retain Guam's current nurses and physicians? 2 minutes will be here now.
Can you repeat that again?
Yes, ma'am. So,
when you say healthcare provider, I think about radiologists, pharmacists, laboratory people, technicians. Is that what you're referring to?
yes, ma'am.
Okay. So one of the things I think is we need to really expand more our opportunities with the Guam Community College and the University of Guam and stand up an educational program that will train radiology technicians, that will train medical laboratory technicians, that will train nursing assistants, that will train other healthcare providers like the respiratory technologists. And so we can use our current mechanism of higher education to make that happen. We can also use GCC so that we can push out quickly more our LPNs. We can use GCC so we can push out quickly our certified nurses assistants. We also have private organizations that do train. We have Faye Wallace's business that trains medical assistants, laboratory technicians. So we have the resources within our own environment to beef up those educational programs so that we can provide the necessary healthcare providers here and not necessarily having to go off island to recruit them.
Thank you, Governor. Congressman, you'll have your 1 minute rebuttal.
If I could just clarify the question, are you asking how do we go about retaining the professionals when they come?
Retaining and supporting the professionals as they come, and the ones that are currently here are generated and recruited to the island. How do we keep them here on the island?
So the question is focused on retention.
Yes, sir.
Well, I mean, when it comes to educating our future crop of healthcare professionals, one of the really good examples we've seen when it comes to retention was in the Annotated Educator Corps Scholarship in Education, where there is a service requirement after being able to go out and get your degree and then you come back and you put in your years of service. So having those kind of tie-ins where we're marrying the resources we're deploying to build up the workforce with the requirements in order to comply and to receive those kind of supports, I think those are policy issues that we really need to be focusing resources into. The more kind of scholarships like that we can push out, the more professionals are going to be able to stand up for the industry, and the more we're going to be able to actually retain, at least for that service payback period, because then they're going to be able to commit so many years to our people and then finally make career decisions after that. Right now, the real challenge is there's shortages everywhere. Our professionals that are staying because they love Guam. They're staying because they love our people. They're certainly not staying for money, and they're certainly not staying because things are less expensive here. It's the opposite.
Thank you, Congressman. Governor, you'll have your 30-second response.
In any kind of organization and human resource management, in order for them to be retained, you look at why they are not staying. They're not staying because of salary, and they're not staying because of the working environment. So definitely, when we build our hospital, that is an attraction, and that's a way to retain our people here and increase their salaries, because They do a lot of hard work, and they need to be compensated for the value of their work.
Thank you, Governor. That will conclude our first segment, and we will begin a 5-minute intermission as we change between candidates to the Lieutenant Governor segment. Thank you very much.
No, it's just to the mic.
I guess that's I'm not there as often. 20%. But I would say but it's best to sit like that.
Yeah, this is very close to Guam. So far, so good. We try to keep the question very neutral.
Afternoon, good evening, Guam. I'm Jason Salas for KUM News. If you were just joining us, you are watching KUM's live coverage of the Guam Medical Association's 2022 Gubernatorial debate. We are currently in an intermission. We've got about 2 minutes left, and then the Lieutenant Governor candidates will take the stage. Of course, the incumbent Democrat, Josh Tenorio, and the first time looking to assume the role of Guam's second in command, former journalist Sabrina Salas Matanane. So if you just joined us, we had our first segment with incumbent Governor Guerrero and Congressman Nicolas answering a variety of questions ranging from the state of the hospital, the shortage of nurses, possible specializations, recruitment of more healthcare professionals, and much more. So once again, after this intermission, probably about 2 more minutes, we will have the Lieutenant Governor candidates, incumbent Josh Tenorio and the first timer Sabrina Salas Matanane. That's coming up in about 90 seconds. Thank you for watching.
We're gonna try something else. I'm gonna put the mic closer to the window, so we get signal.
Oh, okay. You good for me? Where's the...
Gang it. See, look at it. Got a SIM card too, though.
guys sit down?
Everyone will begin the next section in 1 minute.
No, not today. Oh, looks like tea.
When the candidates are ready, we'll go ahead and begin the second segment. The two Lieutenant Governor candidates. Dr. Shea, let me get the phone, please.
Okay, all right, let's get it. Now, I'm going to go home. Okay, we'll have the lady call. Sabrina, we need pen to tell.
Can you do that?
Okay, you want to receive or you want to punt? Okay.
So the first question will be for Lieutenant Governor Tenorio, and this is in regards to infectious disease control. The COVID-19 pandemic taught us the importance of controlling the spread of infectious disease. Immunizations are imperative for preventing spread of these diseases. And currently, Medicaid and MIP patients only have 1 hour a day to receive immunization from public health services. What factors must be addressed in order to expand this necessary public service of immunization?
Thank you for the question. I definitely am in favor of expanded access to immunizations, and of course, at the community health centers, you can get that regularly more than just an hour, as I understand. But part of the success of immunizations has been the partnership with the private sector. And in this case, there was, we were able to achieve a high vaccination rate because of the strong partnership that had to do with empowering the private sector providers. I mean, we're a small island, so having a unified approach to trying to address infectious diseases is a critical thing. The other thing I would say is that our experience controlling and addressing tuberculosis have had a lot of influence in our strategy and our method in getting the immunizations out for COVID. In fact, I wanted to recognize Chima over there, who received national recognition for the TB program that has been built at Public Health. But I would say that for immunizations, it's expanded and very liberal hours in the government, but empowering and partnership with the private sector. Thank you.
Thank you, Lieutenant Governor. Mrs. Salas, Matanane, you'll have your 1 minute rebuttal.
Well, I think it's absolutely unacceptable that immunizations are offered 1 hour a day at our community health centers. I think that it should be expanded to 8 to 5 when they are open and offered 8 to 5 at all 3 immunization clinics or all 3 public health community centers.
Thank you, ma'am. Lieutenant Governor, you will have your 30-second response.
Thank you. And just to clarify, you can get on demand your immunizations at the community health centers, those public health clinics. In fact, the next phase or strategy for community health centers is to give them some autonomy and to let them be able to operate real fast. And I think that's going to increase and improve their effectiveness as well. Thank you.
Thank you, Lieutenant Governor. The next question will be for Mrs. Salas Matanane, and this is in regards to hospital accreditation. So in 2018, Guam Memorial Hospital lost its accreditation status, which has made it difficult to acquire certain federal funding which could help support the hospital. How would your administration work to regain accreditation for our hospital? So in 2018, to help support the hospital. Your 2 minutes will begin now.
I remember that reaccreditation was a goal of this particular administration. And here we are 4 years later, and our hospital is still not re-accredited. I think there are steps and things that obviously what we need to do to get it re-accredited. I think one of the things that this administration did was we went from the Joint Commission that was accrediting GMH and switching it to a whole nother organization. So yes, absolutely, re-accreditation for the Guam Memorial Hospital is a top priority for my command.
Thank you, ma'am. Lieutenant Governor, you'll have your 1 minute rebuttal.
Accreditation took a long time to happen at GMH, and our governor and our current hospital administrator both were on the board that got accreditation for the hospital. And it was a shame that it was lost in 2018. But we've been looking at the reports. Our team has been looking at all of the deficiencies that happened back then, and they have been executing a plan to regain accreditation. And this spring, the accreditation team will be coming for its initial visit to put us back on a course for accreditation. I think our administration has the credibility to get it done. After all, we were able to successfully re-accredit Guam Behavioral Health and Wellness Center. We have a very, very good system in place. We have fine individuals at GMH that were responsible for accreditation. The accreditation was lost because of past leadership failures. That leadership has definitely been revisited. We have strong leadership, and we are going to have that hospital accredited.
Thank you, Lieutenant Governor. Mrs. Salas, you'll have your 30-second response.
I think it's great that you guys are going to try and get the hospital re-accredited. That's really all I have to say.
That concludes the response. We'll go ahead and move on to the next question. So this is for Lieutenant Governor Tenorio, and this is going to be about mental health. So during the pandemic, the island saw a rise in demand for mental health services. Despite that, behavioral health has been challenged to match this demand due to a lack of resources available on the island. If re-elected, how would you proceed forward to address our current mental health resource shortage?
I have my hand and my pulse on mental health. I have a regular meeting with their director, trying to make sure that we continue to give them the resources. And that really has been responsible for an increase in the behavioral health, mental health spending by more than 26% from the last time that the Republicans were in charge in 2018. On top of that, behavioral health has, under our leadership, received for the first time and now expanded direct grants from the Substance Abuse and Mental Health Services Authority out of HHS. It's based on credibility that was refreshed and partnered not only with our behavioral health, but with our nonprofit organizations. There's a considerable amount of work that has to happen, and some of the things that we're looking forward to in addressing this COVID situation is expanding into the schools. We have a strong partnership that we have established with the Guam Department of Education. We have school counselors that are now interested in getting licensed and getting the hours with behavioral health so they can go in and do clinical work. That is also going to expand the number of mental health professionals that we have. On top of that, we're introducing an app this fall, Safe GU app, targeted to kids, that's going to allow them to anonymously report behavioral concerns, public safety concerns, suicidal ideations, all these things that sometimes juveniles or young adults don't want to report because they don't want to get blamed. This, in concert with a leadership that has also got behavioral health to be designated federally as a place to receive mental health professionals. There are 3 mental health professionals that are inbound this fall, and we're going to be counting on that and expanding the progress so that we can expand mental health services.
Thank you, Lieutenant Governor. Mrs. Salas, you have your 1 minute rebuttal.
Look, my niece committed suicide, so I know the problems at mental health. And during the COVID pandemic, there were so many people that I'd spoken with and interviews that I've done with people that were so concerned and worried they didn't know where to go. And so our opponents, clearly he's going to get up here and he's going to say they're doing a great job. But the fact remains they don't have enough full-time psychiatrists to treat patients that are in need of this service. They have a full-time psychiatrist that is on vacation. We don't know if he's going to be coming back. They've hired a doctor part-time. They've hired a nurse practitioner. But signing off on prescriptions is not the way you treat the problem at the agency. You need medical professionals, a team of psychiatrists. Now imagine if this administration put more focus on fixing the problems instead of fixing an election by hiring non-essential staff at the Guam Behavioral Health and Wellness Center. Thank you.
Thank you, ma'am. Lieutenant Governor, you will have your 30-second response.
I have to say that we have excellent staff at Guam Behavioral Health and Wellness Center. I'll proudly protect them from any political attacks. The leader of my opponent's team could have done his part as a congressional delegate by providing a pathway to designate Guam and give them the designations to expand the number of medical health professionals that could come. There are certain federal designations that can be made through HRSA and other organizations. So, if you want to be part of the problem, then be part of the problem. I'm part of the solution.
Thank you, Lieutenant Governor. The next question will be for Mrs. Salas Matanane. It's in regards to outdoor facilities. So with the growing concern for people's physical health, doctors are now more than ever recommending for their patients to go outside and exercise. If elected, how will your administration provide access to safe and clean modern parks and recreational facilities? The 2 minutes will be enough.
Well, because I am from the village of Agate, I just got a call from my uncle the other day. They were wanting to hold a barbecue at Nimitz Beach, and they paid for the fees, but Parks and Recs told them, maybe you shouldn't do that, go to EPAL, because there's no power, there's no water, and the restrooms are locked. So if we want to have outdoor activities, especially at our public parks, then we should actually clean them and not just talk about investing $50 million in a smart park in Tumon for tourists.
Yep. Thank you, ma'am. Lieutenant Governor, you may begin your 1 minute rebuttal.
Thank you. There's a significant investment going on recovering parks and recreational areas throughout the island. Considerable amount of outdoor fields are getting those covers and still open air so that we can mitigate against some of the threats that we've been seeing in the last few years. Down at Nimitz Beach, one of the big things that's happening is we're losing the shoreline. And we're working with the Army Corps right now to restore that shoreline and make sure that that park is going to be presentable. Once the investment is made, we intend to transfer that park under the direct jurisdiction of the Agate Mayor. And we always find that empowering the mayors and giving them the resources to be the first responders is the way to go. And that's the direction that our administration is heading to. One thing, though, I have to say is on top of providing facilities, we provide programs. And in these last couple of years, we've been able to provide resources to nonprofit organizations like Clutch and others that are out there recruiting youth, coaching them, and getting them to be more active.
Thank you, Lieutenant Governor. Mrs. Salas Matanane, you'll have your 30-second response.
Look, I'm not a politician, so I'm not going to come up here and give all these savvy answers. Clearly, you saw I kind of flopped on some of them earlier. But what I know is that it's not just Nimitz Beach, it's other parks in our community that need to be improved.
Thank you, ma'am. We'll move on to the next question, which will be for Lieutenant Governor Tenorio. And this is also another question about healthcare coverage. So, migrants from the Federated States of Micronesia remain among the most affected by disparities in health on our island. This is further exemplified by the disproportionality in deaths that we witnessed during the COVID-19 pandemic, and we still witness today. With the passing of the Consolidated Appropriations Act of 2021, Medicaid coverage has been expanded to all of these migrants who come to Guam as part of the Compact of Free Association. How do you plan to leverage this federal program to help this community overcome these health disparities, and what are the main challenges you believe need to be addressed?
Well, one of the things we're doing already is migrating folks and bringing them up. Right now, we have already registered 4,933 COFA citizens into the Medicaid program. That, on top of another population, means that the total folks from Micronesian descent on Medicaid are 13,141. We know that this population has the problem with access to health care, and a lot of that has to do with some of the conditions that they're living in. So some of the other work that needs to happen is improving infrastructure. We have a big infrastructure project we're working on to provide water and wastewater to all of those residents up there that were swindled and were given lots without all of that up there in Geo. But back to Medicaid, what we're doing right now, working with our health advisor, Senator Rodriguez, we've expanded the number of folks that can receive those applications, dispatching them at our relief center also, and the mayor's office, to make sure that these applications are complete and we can catch up with a couple-month backlog that we've seen as a result of this interest. I want to also say that right now, the future, based on geopolitics, there's a lot of interest from our federal partners to make sure that our COFA citizens that are living here and elsewhere in the states are going to be receiving proper benefits and proper coverage. This includes veterans who are underserved and not served living elsewhere. And so some of the discussions that we're having at the highest levels with our federal partners are utilizing and taking advantage of geopolitics and bringing in more opportunities so that we can expand the kind of services and also partner with our local private sector medical partners to help expand the kind of work that they can do elsewhere. Thank you.
Thank you, Lieutenant Governor. Mrs. Salas Matanane, you'll have your 1 minute rebuttal.
First, thank you to Congressman Nicolas for his efforts in availing eligibility for FSM citizens into the Medicaid program. The problem now, though, from what I'm hearing, is public health is not processing the paperwork quickly enough. We hear some have been waiting up to 6 months, and it's not just our COFA brothers and sisters waiting either. What we propose is mobilizing a Medicaid action corps of detailed non-essential Guam workers to provide end-to-end support for the over 10,000 families that are eligible for coverage but do not currently have the support that they need to enroll into the program.
Thank you, ma'am. Lieutenant Governor, you'll have your 30-second response.
They probably need to check their numbers and update them because I think I've already showed you that we made some tremendous progress. But of course, things are not perfect, and those are things and areas that we go and bring attention. And part of this is empowering nonprofit organizations that are out there in the front lines to give them the authority to receive these applications and doing clinics. Last thing I want to say, fortunately, we had the migration westward by COFA citizens into Oregon and Washington and Arkansas gave us finally national attention to get this done. And it wasn't the Congressman that was leading the effort.
Thank you, Lieutenant Governor. We're going to move on to the next question, and this is going to be for Mrs. Salas Matanane. This is in regards to a physician shortage. So I'm about to start my training as a physician, and I have a lot of peers who are also about to start from Guam as well. And so I'm committed to returning to the island, and a lot of my peers are as well, and I know a lot of these physicians out here have peers as well who are committed to returning to the island. But there are some difficulties that are encountered along the way. The question is, how do you intend to create programs that will entice future homegrown physicians like myself to return to the island? 2 minutes will begin now.
Well, first, thank you for wanting to return to Guam because we definitely do need doctors here. I know that in conversations that we've had with some of the physicians, there are some issues with, I think it's licensing and visas. And so I think we need to continue those discussions with these physicians because for me, I'm not an expert in healthcare, but I am a good listener. And so that's what I plan to do, and Mike and I plan to do, is work with all of you in this room that are medical professionals to figure out a solution so that we can recruit and retain more physicians for Guam.
Thank you very much, ma'am. Lieutenant Governor, your 1 minute rebuttal will be now.
Thank you. We have a partnership going on right now that is identifying all the different things that we can fold into a strategy to address the physician shortage and really try and support all of the physicians that are going out there. In fact, just listening to Dr. Alfred and listening to the peril she received when she got the Protect Scholarship, then was sort of discouraged from going into getting specialty care because of some bureaucracy. But I think reforming those, and we're on the path to do that. Plus, we've seen now that we can use a digital infrastructure and virtual means to fast-track licensing in a very responsible way. We're able to do that during the COVID pandemic. And I know that the Board of Medical Examiners and in particular Dr. David, is focused in on those improvements. And I think that continuing to work with the private sector also, some of it could be that the hospital or public health has duly employed folks, duly employed in the government, duly employed in the private sector, that give them the financial means and the patient and the expanded patient base to do a good job.
Thank you, Lieutenant Governor. Mr. Salas, your 30-second response.
I think what we can also do is implement a federal program that is used to recruit physicians to come to remote locations such as Guam. From what I understand, that there are certain things that the Guam Memorial Hospital has to do in order for us to be eligible to implement that program. And so I look forward to working with the GMA and the GMS.
Thank you, Mel. The next question is very similar to what's been discussed so far, and it's about the physician loan forgiveness programs. So this one will be for Lieutenant Governor. Some Guam Island providers are interested in practicing in Guam, especially at the community health centers as part of a loan repayment program. However, they find other jobs during the time it takes to process and hire them. You might have mentioned this already, but maybe expand a little bit further. How does your administration plan to streamline the hiring and credentialing process for interested providers?
Well, a couple of things first. Let me just say that community health centers, we're working with the chairs of the North and the South to come up with some legislation that is going to give the community health centers some autonomy and let them operate kind of similar to how they're operating in the CNMI. Still, of course, strong support with the Department of Public Health, but give them the authority and the flexibility to really respond and get through some of the bureaucracy that the line agencies go through. With regards to licensing, I really do think that it has to do with technology. And I think that right now the Guam Board of Medical Examiners is working on a pathway, looking at our COVID experience and implementing some long-term reforms. There have been already some long-term reforms in some of the other licensed areas that have been caused because of the COVID situation and our need to bring in and fast-track credentialing, especially from the military and traveling folks that came in during the height of the emergency. But it's going to be that, but it's also going to be making sure that we protect our physicians from irresponsible legislation that would open them up for baseless accusations. And so recent legislation that has been proposed, most, if not every single medical provider is coming out there talking about how this is going to jeopardize Guam being a safe place for physicians to practice. And I think that there, of course, is going to be an improvement when we're able to give people a faster, quicker opportunity to address legitimate claims against physicians. But that being said, you have to make sure that we listen to the physicians and protect the integrity of their practice and protect them from any any allegations that are baseless. Thank you.
Lieutenant Governor, Mrs. Salas Matanane, your 1 minute rebuttal.
Can you repeat the question?
How does your administration plan to streamline the hiring and credentialing process of interested providers?
I think I want to just follow up on what Josh said, because I think he was referencing arbitration. First, I want to just say that Secretary Sirlahi, Tenorio, I appreciate their relentless efforts in trying to resolve the issue and also come up with a compromise, because I think that we don't want to ignore the voices of the patients and the people of Guam that are concerned about the high cost of arbitration. And from what I understand, there is a compromise on the table with respect to licensure. So when a physician renews his license, they would pay a certain fee. That fee goes into a fund. That fund is matched by the government of Guam. Someone who files a complaint or feels that they've been wronged would be able to access that fund if they meet certain income criteria. And if they win their case, then they would pay that money back into that fund. If they lose that case, then they wouldn't pay anything, so there would be zero cost.
Thank you, ma'am. Lieutenant Governor, your 30-second response.
Thank you very much. I'm glad to hear, and we'll make sure that any changes to the legislation are going to be endorsed by our medical professionals. We need to make sure that they're part of the solution to this. And there's no question that there has to be an improvement to patients. Guam patients are people having a good process to pursue legitimate complaints. But these have to, we have to make sure that we understand everything, that all the consequences of the changes, and make sure that we get our doctors on board with them. Thank you.
Thank you. May I refer to the timekeepers? Maybe we have one more time for one more question for this segment? All right. So this next question will be for Mrs. Salas Matanane. In regards to physician shortage, particularly with women's health and prenatal care. So Guam has one of the highest infant mortality rates in the nation. We are limited in prenatal care providers and currently have no neonatologists at GMH. How does your administration plan to address this issue?
I think that question should be posed to the Guam Medical Association and the Guam Medical Society, because again, I am not a medical professional, so I don't know all the inner workings of how you manage and do what you do. So that will be one of the things that I plan on doing if I'm elected, is actually working with you and listening to you, because you guys hold the solutions.
Can you repeat the question?
Sure. With no neonatologists at GMH, how does your administration plan to address this issue that's very important for the prenatal care of our island's mothers and children?
I think that it's very critical that we provide adequate facilities and a good patient base in order to attract specialists like that. And so in addition to what we talked about in the last round of questionings, making sure that that we have adequate protections for them, and also making sure they have a good patient base, we also need to make sure that we provide them with the facilities. And certainly building a new public hospital is going to provide them with that facility and support, technology, and all those things that are necessary for a practitioner to really excel at the practice. The other thing, though, with regards to women's health, I have to say that part of women's health is women's reproductive health. And I just have to take this opportunity to say that I really do think that the governor and I, of course, are both very protective of women's reproductive health. We want to make sure that that, as an option, continues to remain on Guam for them. Thank you.
Thank you very much, Lieutenant Governor. Mrs. Salas Matanane, you have your 30-second response.
I don't have a rebuttal.
All right, with that, we will go ahead and conclude this second segment, and we will begin a 5-minute intermission again. So thank you very much.
Hafade, once again, ladies and gentlemen, you are watching KUM's continuing live streaming coverage of the 2022 gubernatorial debates presented by the Guam Medical Association. And as you've seen, the GMA, not just the island's physicians, there are a great many of them. I'm looking out in the crowd right now, probably better than 100 such medical professionals joining us tonight. But it's also the doctors, the nursing community, also many people involved in pharmacies, people of that nature. Many questions posed tonight and being posed to that latest round with the lieutenant governor candidates, the incumbent lieutenant governor Josh Tenorio and the upstart candidate Sabrina Salas Matanane, peppered with a series of questions focusing on retention of healthcare workers, people that grew up here and make this their home and they want to come back. How do we do that? The most recent question asking about ensuring not just adequate but outstanding care in the neonatal realm of healthcare, making sure that expectant mothers as well as newborns and babies are taken care of with exemplary service. Not just going for the status quo, but ensuring outstanding coverage. This final round will feature both the gubernatorial candidates joining the stage once again, as well as the lieutenant governor candidates. So both teams will be on full display. So once again, you're watching the 2022 gubernatorial debates presented by the Guam Medical Association. It got a little chippy there in the beginning. The candidate, particularly on the lieutenant governor's side, kind of going back and forth at each other's points, trying to emphasize some of the aspects of their platforms, of the plans that they propose going forward with healthcare coverage. And again, if you're just joining us, the fact that the medical community here at large pretty much joining in unison in saying the conditions at the Guam Memorial Hospital in Tamuning pretty much substandard at this point, has nothing to do with the staff, has nothing to do with compassion, but the facilities themselves greatly in need of basically like a reboot. And the gubernatorial candidates presenting their ideas, their solutions for that. The lieutenant governor candidates also sharing their thoughts. So in just about 90 seconds, we will have, once again, the incumbent gubernatorial team of Governor Leon Guerrero and Lieutenant Governor Josh Tenorio, along with fellow Democrats, but opposing them, Congressman Nicolas and Sabrina Salas Matanane, with a final round of questions. So thank you again for streaming and enjoy this final round.
What did Mike say?
You can tell we're related.
Perfect.
Are you going to bring it over? Once more, ladies and gentlemen, you are watching KUM's continuing live stream coverage of the gubernatorial debates presented by the Guam Medical Association. It has been very, very lively, and in just a few moments, we're going to ask the crowd to please take their seats once again, and the final round will feature the gubernatorial candidates and lieutenant governor candidates. So we'll have all four on the stage answering a final round of questions about the hospital, about healthcare, about physician retention, and many, many of the issues facing our island's critical and essential medical community. So that is beginning in about 45 seconds. Enjoy this final round once again. Thank you.
Thank you, everyone. So, Dr. Shea had to step out to see some patients, so I'll be going ahead and conducting the final coin toss. So both candidate teams could join me in the middle of the coin toss. So we don't have the special coin this time. I have to ask Dr. Bo to borrow this, so we're going to reimburse him later. We'll begin with Governor again. So, all right. It is heads. Would you like to punch or receive? Okay, punch. So this segment will feature both team members from both camps, and at the discretion of the team members, they can decide who will respond to the question. They can go back in between, but it's going to be the same time segment. So 2-minute response, 1 minute rebuttal, and 30-second following response. Right. Okay. So the first question will be for the Nicolas, Salas, Matanane team. and it will be in regards to infectious disease control. With the COVID-19 pandemic, we learned that there are many limitations within both the public and private healthcare services. How does your administration plan to prepare private healthcare facilities for infectious disease outbreaks on our island?
Well, Bree and I know that a lot of you folks in the private sector have made your own investments to kind of adjust how you do business because the COVID situation is still very real, as evidenced by all the masks in the room. And infectious diseases are going to continue to be a reality of the human condition, time eternal. So these investments that you've made are definitely sound investments that are good for your patient base and good for our community. But Bree and I firmly believe that those kind of investments need to be supported by the government. I understand that there are a number of you private practitioners out there who have incurred costs to put in these safety precautions, and you haven't necessarily received the federal support that's available to you to be able to offset those costs. So those kind of things need to be more fluid, they need to be more transparent, they need to be more readily available. But it's a matter of making the necessary investments. And of course, the private sector, you folks can make investments as you see fit. But as medical professionals, I believe that decision within your own capacity is going to be something that you're going to be able to make at the base level. And we made it very clear tonight that we want to listen to you folks. We want to listen to the GMA, we want to keep the GMS and the medical community. And so communicate. Let us know exactly what we need to on a policy level, on a financial level, to get those precautions in place. We'll continue doing what you're doing, and we can support it as much as we can on our end.
I believe you have 30 seconds remaining if you would like to continue the response. Otherwise, we can move on to the rebuttal. So, Governor, you may begin your 1 minute rebuttal.
Can you repeat the question?
Yes, ma'am. So, how does your administration, if re-elected, plan to prepare private healthcare facilities for future infectious disease outbreaks on our island?
There are definitely going to be future outbreaks in our island. We're looking at monkeypox as a potential. At our public health community center, public health services, we have an infectious disease unit. And these infectious disease unit have a very strong communication and relationship with the clinics. We have worked very closely during this pandemic with the clinics. In fact, we stood up a Cures Act where we used the clinics to help us with the testing, with the vaccination, with the tracking, and certainly we invested in those private clinics. We've invested monies into their infrastructure. We've invested money into their the vaccines, and we've invested money into their testing programs.
Thank you, Governor. Congressman Nicolas and Mrs. Salas, Matanane, you may have your 30-second response.
Well, Bree and I, when we listen to the responses, we're just a little dumbfounded because these answers are coming directly from the constituents. They're coming from the clinics. They're coming from you doctors out there, you private practitioners. You're the ones who are telling us that these things are not happening, that this support is not coming your way. So debates are interesting things because people can get up and say one thing or say another, but you guys know what your realities are. And those realities are what needs to get addressed. We and I are committed to facing those realities and addressing them.
Thank you, Congressman. We'll move on to the next question, and this will be for the incumbent team. And this question is in regards to abortion. So with the overturn of Roe v. Wade by the U.S. Supreme Court, the issue of abortion has been left in the hands of the states and the territories. What will be your administration's approach with respect to abortion policy?
Thank you very much. Josh and I are very solid on our position about women's health rights and women's reproductive rights, and women's right to privacy and women's right to confidentiality. We're very solid on that position. The day that Roe v. Wade was overturned was the dark day for women. It has set back women's health years of fighting and years of going forward and years of making sure that our constitutional rights are protected. It's unfortunate that Roe v. Wade has been removed. If there is any legislation that in any way restricts the woman's right to health and privacy, I will veto that legislation. I will work with our women's group. I would work with our healthcare providers. I would work with our healthcare facilities to make sure that healthcare care is provided for the reproductive health of our people. I will make sure that abortion becomes legal. I will make sure that abortion is done in a safe, legal, and hygienic environment. I have gone through the age where I have seen women in ER hemorrhaging from back alley abortions. We do not want to go that route. I implore the legislature and I implore the people of Guam to please protect our women's right to reproductive health. And if there is legislation that comes down that restricts that legality, then I think it should go out as a referendum so the people of Guam can have their input and the people of Guam can decide through referendum.
Thank you, Governor. Congressman and Mrs. Salas Matanane, you may have your 1 minute rebuttal.
Thank you, Kai. This is a very sensitive issue in our community. And on both sides, there's American issues. Bree has expressed that she's definitely a pro-choice individual, and my wife and I, our family, we're pro-life. And it's just a hard issue for our community to deal with. Roe v. Wade did something very specific, the overturning of it. It put the issue to the states. It put the issue to the territories. What we need to do responsibly as leaders is we need to put the question to people. We need to ask a very direct referendum question. Do you want your local government to pursue pro-choice or pro-life policies? And let the people give us very clear guidance. Because as we navigate this difficult issue, it's going to be something that we're going to have to come together as a community on, and it's going to require our community's input. So let's put that question to our people. We really should not delay. Roe v. Wade has already been overturned. Let's get clear guidance, and from that guidance, our policymakers can begin to make the necessary policy decisions around the very direct information that our people provide for us in that referendum.
30 seconds response, Governor.
Certainly, I agree that we should put it out as a referendum and get the people's input and get the people's desire. I will guarantee you that the people will say, let's protect the rights of women to reproductive health, the rights of women to privacy, and the rights of women to confidentiality.
Thank you, Governor. We will move on to another question, which is also pertaining to women's health. Again, harking on the theme of physician recruitment and retention. So this question will go to the Nicolas team and Sabrina Salas Matanane team. With only 3 full-time and 4 part-time obstetricians on the island, it can take 15 weeks to get an appointment, meaning many women will not be able to see an OB in their first trimester. What factors would you consider in addressing this shortage in women's health specialists?
You know, a lot of the questions are very similar about the issue of recruitment and retention. You know, what are we doing to bring these professionals over here? What are we doing to keep them here? And we talked, both sides, both of us tonight have talked about the need for us to focus attention and resources on that issue. And Bree's made it very clear that we need to ask you folks too. I mean, what, if you're an OB here and you're staying here or you came here, what brought you here? You know, what made you want to stay? And if you're considering having to move, you know, what could keep you here? Or, you know, if you know you're dialed into the industry, what are your fellow industry professionals looking for? You know, that's why when Bree brings to the table the listening component and just being very real about the issue, it's just so valuable. Because as politicians, this is what she taught me. You know, we have a tendency to try to always be the one to go out there and say, this is what you need to do, and that's what you need to do. But when it comes to recruitment and retention, she's right. You know, we need to ask guys, how do we get you guys to come? How do we get you guys to stay? What is the industry looking for? And then focus things on that end. Sometimes, you know, we get very focused on the issue of compensation. The reality is that's always going to be an issue. But what are some unique things that we can explore? You know, maybe housing allowances for those kind of professionals. Something that other places aren't doing that we can do here to make us a more unique destination. Those kind of conversations are conversations that should be had. But I think that first and foremost, Bree's right, we gotta listen. And we gotta get the advice from you folks on where we're going to be able to be most effective in deploying resources to recruit and retain these kind of critical positions.
If there are no additional remarks, we'll begin the 1 minute rebuttal.
There is a crisis in the maternal child health part of the specialty. It is a crisis of great concern. Josh and I have impaneled a group of physicians represented from the private and the public sector And we did our first meeting and a roundtable discussion. And the group brought forth many ideas, from bringing in locum to working and contracting with hospitals to provide those specialty on a regular rotating basis, to improving licensing processes, to improving hiring policies, and of course, building a new hospital and making sure the equipment and the resources are there to make it available for our doctors to perform. And let's make our island more a doctor-friendly.
You guys had 4 years to do this. You only talking about planning it now. You've had all these funding. You've been the most funded administration in the history of Guam. You've had the most power, emergency powers you still have today. And this is still something that you're only now going to be planning and discussing. You know, we need to talk with you guys, we need to get your input, but we need to act, and it shouldn't take 2 terms to do it.
We'll move on to the next question. And this is in regards to specialty care, recruitment. This will be for the incumbent team. So, many patients from Guam require specialized health care to resolve their complex conditions. But the specialists required to perform these therapies and operations are only accessible alongside the hefty expense of travel. How do you intend to attract specialized healthcare providers and all their ancillary requirements to practice their specialties and subspecialties on Guam?
Of course, again, like in the past with your questions, this is very similar in past questions. Specialty care, like I said, first, we need to make sure that we know what specialty care we need to bring over. After that, we can work with various hospitals off island. We can work with various universities off island to create a working agreement so that they can come on a rotating basis. A lot of times, the fact that there's not that volume here to provide for that specialty care is a barrier. So one of the things that we are doing is we are working with the other Micronesian islands to also make sure that we can share that specialty care with the other Micronesian islands, CNMI, Pohnpei, Palau, RMI, and so forth, because they too have a lack of specialty services. On the local side here, we can also provide some funding to help them with their travel. We can provide some resources to help them much more be convenient in coming over here. We can provide them with housing while they're here so that it is not a barrier to getting here. We are already doing this, by the way, at the hospital. We are sharing a specialty right now with neurology, with GRMC and GMH. We know a cardiologist from Good Samaritan who comes here on a rotating basis every 3 months that works with Dr. Hanaba in terms of cardiology. We know of people that come in for rheumatology, for gastroenterology, working with the other clinics to make sure we share that specialty care, because the goal is to provide services to our people.
Thank you, Governor. Mrs. Salas Matanane and Congressman Nicolas, you have your 1 minute rebuttal.
Okay, how did you repeat the question, please?
Yes, sir. How do your administration intend to attract specialized healthcare providers and the ancillary services that will come along with those subspecialties to practice their subspecialties and specialties on island?
Again, this is as the governor mentioned, this is very similar to some previous questions in terms of recruitment and retention. Getting specialists here and having them permanently stationed here is absolutely ideal. There are some realities that we need to have a very serious conversation about, and maybe the doctors and the medical professionals can help us to figure out those realities. But one of the bigger realities is patient volume. You know, if we're going to bring in a certain specialist to be able to provide a service here on Guam, is the patient volume going to be there for them to actually sustain their practice? You know, those patient volumes are there, then by all means, you know, what's holding us back? Let's get to the root of the problem, figure out the incentives, and figure out where to go and find the expertise. But if we're talking about a challenge of patient volume, then we have to have a conversation with our medical professionals and say, hey, you know, so what kind of scheduling do we need to work out, and how do we need to find these kind of professionals to get here, and on what basis? How do we marry the ability for us to create incentives to have people come and not have that permanently stationed here where they're not going to be able to make a living.
Thank you, Congressman. The 30-second response.
I just wanted to add that in the last question, I almost felt that we were in reality when we've been in a pandemic for 2.5 years, or 3.5 years we've been in office. Have the congressman even been present or even call us for help? You know that our primary focus has been to save people's lives in the pandemic. And we've been able to do this and try and find pathways to increase our recruitment and retention efforts, not only for general physicians, but for those specialists. Thank you.
Thank you very much. We'll move on to the next question. This one will be for Mrs. Salas, Matanane, and Congressman Nicolas. In regards to healthcare facilities. To reduce the cost of healthcare and attract more health professionals to Guam, do you support exempting clinics and private healthcare facilities from the business privilege tax? Please be specific in the factors that you would consider in that decision. 2 minutes will begin now.
Rear and I are just like, yeah. Yeah, we would. I mean, why wouldn't we? You know, those kind of incentives are common sense incentives. So we absolutely should do the business privilege tax exemption for the medical professionals. We should look at other business privilege tax exemptions to help bring down the cost of living around Guam for food and medicine, and figure out how to marry those and our bond covenants, that we can actually do that and help to make Guam more livable again. You know, when it comes to dealing with a pandemic, and when it comes to bringing solutions into our community and deploying resources effectively, can you imagine if California just didn't do anything because they had to deal with the pandemic? Can you imagine if Texas or New York or any of these other states that all were dealing with the pandemic just didn't accomplish their goals because they said they were managing things? That didn't happen. It didn't happen because they had emergency powers just like we have now, we still have now, and we're not accomplishing the things that we're talking about. At least this administration isn't. It just baffles me that we have an administration that's been more funded than any other administration in history. They've had more power than any other administration in history. They still have this power. And we did not resolve these issues. Pandemics are not excuses for us not to get the job done. Your congressional office had to manage a pandemic too. And not only did we deliver on pandemic resources, we delivered on EITC. We delivered on Medicaid. We delivered on COFA Medicaid. We delivered on all these other federal issues that weren't just pandemic related, because the work doesn't stop. So if you have emergency powers and you have funding to get these things done, there's no reason why you're not getting them done. By all means, how do you explain to people at Guam how are you going to do it 4 years from now when those emergency powers go away and those federal dollars are gone?
Thank you. The 1 minute rebuttal will begin now.
We've had 3.5 years. He's had 10 years of the last for continuous elected service. We said that we would stabilize government finances, and we did. And we paid off this $83 million government of Guam general fund deficit so we can get into a position so we can reconsider some tax policy. When you hear the other side, they talk about doom and gloom, yet when you talk with the Department of Defense, you'll see that military construction spending is going to be at a rate of $1.5 billion leading into 2029. We're going to have adequate financial resources finally because we're able to pay off this general fund deficit. And at that point, we certainly can make sure that we reconsider tax policy, but also make sure we expand investments in healthcare. One of the things that we like to do, and we are doing, is expanding and stabilizing funding. Medicaid is being paid 30 days now into the providers. These are things that have never done before, and we have the credibility to deliver.
Thank you. The 30-second response will begin now.
The deficit got paid off because we were able to bring the resources in federally. Folks, we have not had an economy for 3.5 years. You know, what has the government been doing this last 3.5 years when we were dealing with the pandemic, everything was shut down, we had emergency powers to mobilize everybody. Literally, it took away people's freedoms with those emergency powers. So what were you doing with all of that, with all of those resources to actually deliver on these things? You know, those are serious questions. I know it sounds a little combative. But in the end, we're going to have to decide what administration is going to be running this island for the next 4 years. And if they have all this money and all this power, and they're still talking, how are we going to get it done 4 years from now?
Thank you, Congressman. For the next two questions, these are the final two questions, in recognition of the complexity of these issues, we're going to extend the rebuttal to 2 minutes. So it will be a 2-minute answer to the question and a 2-minute rebuttal. Now, we will begin with the incumbent team. So, this question is in regards to Bill 317-36. And where do you stand regarding Bill 317-36, which would create a publicly searchable physician profile that would include any and all complaints, including unsubstantiated accusations brought against the physicians at Guam? Is this a bill that you would support or veto?
This is a dangerous bill. I will never support this bill. This bill is a vigilante bill. This bill puts out $10,000 reward for tattletelling on someone who has had an abortion or someone who did an abortion. I think that's very irresponsible. That's the bill, right? The arbitration.
May I refer to my physician panel?
Arbitration.
No, let me explain that. Who has mine? Yeah, Bill
317-36 is the bill regarding publishing the unsubstantiated claims of physician complaints.
Oh, okay.
Yeah.
It's not the arbitration bill.
No, it's not.
Well, I think it's still very dangerous. And I think it's still not very responsible. Because this bill, to publish accusations, even if it's not being justified, is, I think, total reckless performance. I don't support this. Yes, there are claims that occur. Yes, there are errors that are made. But without giving due process to our doctors, even our nurses, I don't think that's right. So I don't support this bill. I think what we need to do is work towards supporting our doctors so that they can practice in a much more safe and conducive environment with equipment and diagnostic equipment that would help them better make their diagnosis. I think we need to look at how we can support our doctors and our nurses so they don't make those errors. We also have to make sure that our patients can feel that they can also have a place for appeal or for discussing these claims that they make. I think we also have to make sure that we are able to create a communicative environment and to better improve the bedside communication with our patients and to also better relate to our patients so that the doctor and the patient know each other and they tell each other about information, and so that can prevent any kind of claims going forward. So no, I don't support this 317. I don't think it's right, and I think it's dangerous and irresponsible.
Thank you, Governor. Your 2-minute rebuttal will begin now, Congressman.
Thank you. I have some experience on substantiated claims. I know how damaging they can be. I know how they can hurt families. I know how there are people in this room who can take unsubstantiated claims and use it to hurt families. I know that there are people in this room who sanction those kind of things to be happening. So I can absolutely empathize that unsubstantiated claims have no business being put out there in ways that are going to be harmful to you or to your families. No business.
If there are no additional remarks, there will be a 30-second response.
I talked about unsubstantiated claims. What the Congressman is talking about is the ethics report. And if you read the ethics report, the report says that they have found substantive evidence, and so I am talking about unsubstantiated claims, not substantiated evidence.
Thank you, Governor. We'll move on to the final question of, I'm sorry, it's an additional question. Sorry. This question will be directed towards the Mrs. Salas Matanane and Congressman team in regards to healthcare coverage. And again, this will have a 2-minute response and a 2-minute rebuttal and a 30-second response as well. So the question is, what are your thoughts on universal healthcare? 2 minutes will begin now.
I think healthcare for everybody is something that we absolutely should pursue this community. I think that I'm a believer that healthcare should be a right. I think that we will agree with me. I think that the unavailability of healthcare for our community and for those who are uninsured is just so childish. And that's why it was so rewarding to be able to just get the Medicaid solution and get the COPA Medicaid solution, because we're filling the gaps. We're filling the gaps in those communities that otherwise wouldn't be able to get the healthcare that they need. That's why Bree was passionate about doing the job faster in terms of processing our COPA migrants. Yeah, we processed 4,000. There's still 10,000 out there. Mobilize the government workforce. Use those emergency powers to get the people out there into the streets to sign these people up. Let's get them their Medicaid. Even the doctors are coming to us saying we still have patients walking in and they don't have the Medicaid. They're actually able to avail of it. These are all things that can be implemented. And the power to implement it is already there. The funds are already there. This is the thing that we should be talking about as a policy. This is something we should be executing as a government. Universal healthcare is definitely an avenue to take. There's going to be a pathway to do that, and it's not going to happen overnight. But it's one of the many principles that we believe is something that we should embrace in this community. Everybody having access to healthcare. Nobody having to put something off because they don't have insurance. The doctors even communicated to us that some patients would come in too sick to be able to treat them with what would have been more effective and less invasive treatments and procedures. And that really has to stop in our community. That's not who Guam is.
If that concludes the answer, we'll move to the 2-minute rebuttal.
Absolutely. In this pandemic, yes, it's a public health emergency. It's an emergency worldwide. And emergency powers are there to do just that. Treat the situation urgently. And as a result of the emergency powers, I was able to make decisive actions. I was able to make quick actions. I was able to bring quick resources. I was able to push out $2.2 billion in financial aid as a result of our emergency power. So there is value in that emergency power. And look at where we are today. As a result of that, we are turning a corner from the pandemic. We are now vaccinated, we are protected, and we are opening normally. Businesses are returning, schools are opening. On the issue of universal health insurance or health coverage, I totally agree with that. I think every person has the right to accessible, affordable, and available healthcare services. Our administration made that as a priority. And we pushed out and invested in our hospitals. We invested in our doctors. We invested in our clinics to make that happen. So yes, we can do more, and we are doing more. Healthcare is a very complicated industry. It's a very complicated system of delivery. And being in healthcare for more than 30 years gives me, I think, the confidence to address our health disparities. So please be assured that this administration invests in our people, and yes, universal healthcare coverage is a right.
Thank you, Governor. A 30-second response will begin now.
I believe we see eye to eye on this issue. I think that I guess our difference is in execution. We and I are executors. What we've done for you congressionally, what we've done for you over the last 25 years, bringing the news to you. We're executors. So these things need to be executed, not just talked about. Let's get these things done. And my goodness, you can give us emergency powers to do it. I promise you we will. Without that, we'll still be able to work with everybody and with the legislature. I just wanted to give a shout out to them because they've just been phenomenal partners throughout our congressional service.
Thank you, Congressman. That concludes this final segment. We will now move to a closing remarks from each of the 4 candidates. They'll have 2 minutes to deliver their closing remarks. Each has 2 minutes. More.
Okay. There is no rule of this last closing remark. You have 2 minutes each if you want, or you can spend
Total 4 minutes, but try to keep it to the point.
4 minutes per team.
We are very generous.
So this last segment began with the incumbent team, so we will just go ahead and defer this closing remarks to the decision to the Congressman and Ms. Salas Matanane, if they would like to punt or receive it. Okay.
We will punt.
Okay. Lieutenant Governor, your 2 minutes, or 4 minutes total will begin now.
Thank you very much, and thank you for giving us this opportunity to speak about healthcare. As Lieutenant Governor, the Governor has sought my partnership in addressing some of the most complicated healthcare issues and also some great opportunities in healthcare. And some of the things that I've done with her is pursue and continue to follow on the expansion of Medicaid. In a trip I recently took in Washington, I spent time with leaders on the House and Senate Republican side, making sure that they understand that the national defense of our country, dependent on Guam, means that healthcare should be stabilized not only for Guam, but for the entire region. I've had an opportunity to work with the Governor to focus on veterans health services at the highest levels, taking advantage of an opportunity with geopolitics to provide opportunities and pathways for a big U.S. Department of Veterans Affairs healthcare investment on Guam. This is going to include processing on Guam, and it's also going to provide opportunities for COFA residents who are U.S. veterans to get healthcare here on Guam. And building a veterans clinic is going to be the pinnacle of that. This kind of investment is going to facilitate and provide expanded healthcare coverage for our veterans. The last 2.5 years have been difficult, but I have to say that the partnership and the work of everybody in this room and the Medical Association has meant that we've been able to manage the pandemic despite our isolation from the rest of the world. And over the last 3.5 years, we've had the privilege to lead our government into paying off a decades and decades and decades long general fund deficit. We were able to restore credibility with our federal partners and eliminate 3 federal receiverships. Those are the kinds of results that you can continue to depend on when you vote for us. And I ask you to please vote for Guerrero and Josh Tenorio. You can start voting already at the Westin and get everybody out there registered. Please vote for us, and we will continue to do the people's work and focus on improving the quality of their lives. Thank you very much.
I want to thank the hard work of our medical community. Thank you so much for being there to fight and to help with the COVID containment. I can't help but feel the excitement of our people and the hope that our people feel out there. Tonight, we presented you with our hard work, our accomplishments, and our achievements to address health disparities. We shared with you our visions on improving our healthcare delivery services, our plans to increase healthcare professionals and resources. We presented our progress in building a medical complex center to include a new hospital, public health, veterans clinic, and behavioral health. You see around you that our economy is recovering. You see around you that we are returning to some normalcy. Our businesses are open, our schools are open, and our tourism is returning. Yes, it is election time, and we are asking for your support to give us 4 more years. We are in this race without a cloud over our heads. We are in this race without having to answer questions about our integrity. We are in this race fully engaged with you. As you go to cast your vote, ask yourself this question. Do you want a leader that gives you hope or hopelessness? Do you want a leader that is experienced or just learning? Do you want a leader that is responsible or reckless? I ask you at the end of the day to say, who do you trust to move our island forward? I say, Lou and Josh, we ask you for your vote.
Thank you very much.
remarks from Congressman Salas and Tenorio.
Hi there, everybody. Like I said at the candidate debate, I am not a politician, and it was clear from the answers I gave tonight. But I want to thank all of the organizers for tonight's debate, and I'm glad that it's in front of a room full of medical professionals. And tonight I'm not speaking, again, like a politician. I'm speaking like the people that are watching at home. Because I'm sick. I'm sick because when my father wanted to come back to Guam, he couldn't, because we don't have the specialists that he would need for his medical care. He died in December, and I buried him last month. That is why I was off island. I'm sick because my mother is in the same position. She wants to come home and live here, but she can't. I'm sick that when we go out to visit people at their homes, they're scared to go to the hospital or clinic for a checkup because they cannot afford to. I'm sick because for years we've been hearing about a shortage of nurses and doctors, and even as I speak, we're still short nurses and doctors. That is the reality. I'm sick because I read an OPA report that found that from all of the federal grants that we received in fiscal year 2021, there was almost $42 million in questioned costs. I'm sick because I'm here speaking before you when I'd really rather be listening to you, our medical professionals. You are the experts on healthcare. Our opponents will say, well, if you're sick, stay home. If that was the case, then everyone should, even all of you in this room, because we are all sick of these promises from politicians that never deliver. Thank you.
Congressman, you have your 2 minutes.
Thank you very much. Bree is a warrior. Bree is quite a warrior. You know, there's a difference. There's a difference between hopelessness and discussing the realities that people are facing. Discussing them with passion, discussing them pragmatically, discussing them with experts, discussing them with the public. Adopting a philosophy of hope because we want 4 more years is the same politics we've been having, guys. It's the same politics we've been having. And that's why we're still debating these same issues. It's not hopelessness to talk about what people are experiencing. It's not hopelessness to talk about the struggles in our community. It's not hopelessness to talk about what we need to plan and prepare for and the realities that are associated with that. Those kind of real conversations from real people, those are the kind of things that give me hope. And having this kind of conversations with all of you over these last several months and everyone else who we're going to talk to in the weeks ahead. Because when we discuss the challenges and when we discuss the ways we can address them, and we discuss the solutions that we can all work together for, that's where the hope comes from. So let us never characterize the struggles of our people as just embracing hopelessness, because that is turning a blind eye and a deaf ear to the people that you have been entrusted to serve. I'll never forget, during the whole pandemic, the long nights staying up and answering messages and literally getting just a couple hours sleep. You know, I would sleep for you one day, and so will sleep. But that's where the change really begins, and that's what we're going to work for you. Thanks.
I will have the president of the Guam Medical Association, Dr. Che, come back up for the closing remarks for the association. But thank you to all the candidates for the absolute honor, and thank you to the association.
Good job, Kyle. I want to thank both candidates
Congressman Liu and Josh and also Congressman Mike and Bree. I think it's always challenging to come to a healthcare debate. The questions are not easy. We'll critique the questions a little bit more in the next debate, but I think both sides did a very good job, and I want to thank both of them for coming on a busy schedule. And thank you for the audience for behaving. Oh my goodness. All right, thank you very much. And can we do a one favor? Let's have both teams stand side by side so that the media can take a picture of them. How's that? Photo op. Let's give them another round of applause. You can smile. All right. Okay, done. All right. I also want to thank, I'm going to thank Dr. Akimoto, the junior here. He's done a great job. He messaged me about 3 in the morning and said, "Hey, Doc, let me moderate." I said, "Okay, no problem." Thank you. That's right. He's taking over my practice. Go away. Okay. Please drive safely when you go home, and then we'll see you at the next debate. Good luck at the primary election. Please get out and vote. And I want to thank the
Ladies and gentlemen, thank you for watching. That's going to conclude today's 2022 gubernatorial debate presented by the Guam Medical Association. We thank you for watching. We thank you for your comments. We thank you for your reaction emoji. And we thank you for considering the issues and some of the solutions presented here tonight. I'm Jason Salas, and on behalf of all of us at KUM, adios.